Hello everyone, today I will be presenting on teledentistry, a new form of dental care. So to introduce myself briefly, my name is Yujin Lee and I'm from South Korea. I'm a rising senior at North London Collegiate School, JHU. As a STEM enthusiast, I have served as a leader for medical and chemistry student clubs and have written a review paper about treatment of autoimmune diseases via stem cell and CRISPR technology. In relation to today's presentation, I chose the topic teledentistry because I wanted to investigate the concept of telecommunications in healthcare that I've previously explored through school medical review competition more deeply, and also because my interests lie in the field of dentistry. I'm a founder of the dentistry club at my school, and last summer I have completed 2 months of dental work experience and shadowing at Global Dental Clinic. My current interests lie in the field of biotechnology, dentistry, and regenerative medicine, and in the future I wish to work in these fields, making direct contributions to research. This is the table of contents for today's presentation. And to begin with, let me ask you the question, what is teledentistry? Teledentistry refers to an application of telecommunications in the field of dentistry that allows the remote provision of dental healthcare services, such as medical examination and treatment consultation, through transmission of clinical data and images. I believe that global health aims to provide global solutions to common health concerns and to address the issue of health disparity among populations living in low-income or resource settings so that everyone can have equitable access to healthcare systems. In this way, teledentistry strongly relates to the concept of global health as it reduces health inequalities and increases access to oral healthcare for rural and urban communities, as well as underserved vulnerable patient populations. Considering that the mouth is commonly referred to as gateway to oral health of individuals is essential as it performs the most necessary tasks like chewing and speaking, and so is linked closely to people's quality of life. Further, poor oral health status may also increase the risk of developing chronic heart disease and diabetes. Teledentistry is important in modern society as it could provide a new medium through which patients can more conveniently and easily take care of their oral health. To explain its system and mechanism, teledentistry works via connecting the dental professionals with patients online through 2 different forms. Real-time consultation, in which both of them are present in a live video conference, or store and forward, in which dentist and patient exchange information through appropriate established networks. In some cases, the patient visits hub sites near their location, such as nursing homes, where there is special video conferencing equipment with satellite connection, as well as an intraoral camera that can take high-resolution images of the patient's oral conditions. In other instances, the patients can access teledentistry at their houses, where they can take images by using simple camera apps or newly devised autofluorescence oral cancer probes on smartphones that can be easily used without trained staff. The image on screen is an example of smartphone-taken photos at varying dental views. The images taken then will be uploaded to a secure platform that is compliant with the Health Insurance Portability and Accountability Act, HIPAA, such as teledentics and remote eye, where the dental professionals would receive images or data of the patient's oral health status and will be able to store and retrieve patient-related information. Occasionally, common social media or mobile applications such as Skype, Zoom, WhatsApp, and Facebook Messengers are used instead. In the next step, the dentists would make a diagnosis, prescribe medications, or recommend and schedule future visits to the clinic for treatment if necessary. In the process, if the dental professional requires any advice from the specialists in endodontics, oral pathology, or any specific areas of dentistry, they will be able to communicate easily through web network to provide a more accurate diagnosis to the patients. To move on to the benefits of teledentistry, the major advantage that teledentistry brings is an economic benefit for the patients. Since the meeting is done online, the patients, especially those who live in rural communities, do not have to travel long distances to dentist's office for a regular checkup or simple evaluation. This would benefit people by reducing time as well as travel costs. Furthermore, teledentistry resolves other common barriers for healthcare in vulnerable populations, such as low professional to population ratio. Through teledentistry programs, which connects patients with dentists regardless of the distance between them, the underserved community of patients would also be able to easily access dental care. Another aspect to think about is the health benefit. Teledentistry, due to its convenience, could lead to a more regular checkup for the patients and allow identification of oral diseases at its early stage that could be treated to prevent further aggravation. The remote screening through photographic images have shown to be highly effective in identification of oral diseases such as leukoplakia. Furthermore, in special circumstances such as war and pandemic, like COVID-19, in which dentists and transportations to healthcare departments may not be readily available, or there may be risk of transmission by patients, teledentistry could be a promising alternative to those who are really in need of assistance. However, several teledentistry programs still suffer from certain limitations. HIPAA-compliant platforms would rarely have security issues, as the healthcare personnel would use safe, secure username and password. However, if common applications such as Skype and Zoom, which are not HIPAA licensed, there may be certain privacy risks that involve lack of control or limit on the collection, use, and disclosure of sensitive personal information. Moreover, the problem of insufficient infrastructure may arise. In the case of patients who take oral images with their smartphones, the quality of images may be too low, and it might be difficult for dental professionals to accurately identify and diagnose specific conditions and treatments. In conclusion, teledentistry provides an effective, convenient, and economic way for greater population to access oral healthcare and could serve as a successful method to drive an immense decline in dental diseases around the world. Although teledentistry yet may not be prevalent, though through the refinement and further development of current teledentistry programs, a new medium of healthcare may be achievable. Thank you for all your attention, and I hope that you have enjoyed my presentation. If you have any questions, please feel free to contact me via my school email. Lastly, I have included my references here. Thank you.